Welcome to Nursing 1, and this is your first video. We're going to go over Chapter 1 in the Med-Surg book, which is critical thinking and the nursing process. So let me just explain, the nursing process, you've heard about that before. ADPI, it's assessment, diagnosis, planning, implementation or intervention, and then evaluation. So in other words, the nursing process is basically what you do all day long, even in your own lives. Think about it. You are saying to yourself, all right, what kinds of things do I have to do today? So you're assessing the situation, you're coming up with a plan, and then you're going to implement the plan. And after you're done at the end of the day, you'll say, all right, let me evaluate this. Did I get everything done that I needed to get done? And did I do it the way I needed to do it? So that's basically the nursing process. But then there's critical thinking. And critical thinking is really a difficult concept for anyone to teach because it's taking what knowledge you have, things that you've learned, and then applying them to a situation with a patient to hopefully have a good outcome. Okay, so that's basically what this chapter encompasses. So I'll go over the learning objectives. Why is good critical thinking important in nursing? What are the attributes and skills that promote good critical thinking? And then what's the thinking involved in every step of that nursing process? What is your role as the LPN in that nursing process? I'm going to talk about objective and subjective data. We can differentiate them. How do we document them? And then how do we prioritize care based on Maslow's hierarchy of human needs? So when we look at some of the questions that you're going to have about prioritizing care. You may have a question. You are the nurse on a unit and you have gotten your assignment. Which of these 4 patients would you see first? And so what is the process that has to go on in your mind to make that determination? All right, which one of these patients must I see first? Because if I don't, they'll be in trouble. Okay? Okay. So what is critical thinking? The book says it's the use of cognitive skills or strategies that increase the probability of a desirable outcome. Basically, it's using your knowledge, your acquired knowledge base, to make decisions regarding the care of your patients that's in their best interest, that's going to give them a good outcome. Okay? When we talk about, how we go about critical thinking, part of it is clinical judgment. You'll hear me say this a lot, clinical judgment and critical thought. Clinical judgment means after you go through the critical thinking and decision-making process, you go through, and well, if I do this, that might happen, but if I do that, this might happen. All right, then I'm going to use my judgment to make a decision and have that outcome that I'm trying to have with the patient, okay? So what are the attitudes that you need? I'm not going to test you on these, but it's important for us to discuss them. And I'll tell you why. You have got to be able to cultivate these skills and these attributes in yourselves in order to be a good nurse. Not just a nurse, a good nurse. Life is chaos, be kind. One of my favorite statements. You have to want to take care of people, yes. But the other important thing is, how do you maintain an open mind? How do you learn? How do you be the best nurse that you possibly can be? So we'll talk about these attitudes. Intellectual humility. The ability to admit that you don't know everything. I don't know everything. Nobody knows everything, okay? But you have to be able to admit that. And by doing that, you say, listen, I am open to learning, okay? I learn something every day. We all do. Intellectual courage is the ability to entertain another idea, even if you initially disagree with the person. So, politics, which is kind of like talking about politics, talking about religion, no, 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 no. We should be able to have healthy discussions about those things. Even if we disagree, we don't need to get angry, okay? Because that does not help. You want to try to entertain the other idea and say, let me think about that idea at least for a moment, even if I don't particularly like it, but let me be open-minded and think about it, okay? That's intellectual courage. Intellectual empathy. Oh, that patient in 306. Oh my God, all she does is ring the bell. She rings the bell all day long. Put yourself in her position for a moment. And if it were you, how do you think you would feel? She's been in the hospital for so long. Her family hasn't been able to see her or hasn't wanted to come see her, or whatever her situation is. Envision yourself in somebody else's place. Walk a mile in their shoes, right? To understand how they feel and what their point of view may be. Okay? Intellectual empathy. Intellectual autonomy. You must think for yourself. Okay? You don't depend on others to formulate beliefs. You think for yourself. You weigh out all of the things that are options and you make your own informed decision. I was raised in a very strict Italian Catholic household. Once I was old enough, I started saying to myself, I'm not sure if I believe everything that I've been being told to believe. So now I need to think for myself and weigh out all the information, seek out more information, and then formulate my own beliefs. Okay, that's intellectual autonomy. Intellectual integrity, and I'll give you a great example of this, and that means seeking evidence before you believe something. When I was a new nurse, I was working on the floor and we were getting an admission, and the patient had on their diagnosis list, primary diagnosis, pheochromocytoma. And I was a new nurse, and I remember thinking, oh God, what was that again? I don't remember. So I asked one of the nurses that I worked with, an older nurse who'd been a nurse for a long time, hey, I don't remember, what's a pheochromocytoma? And she looked at me and with complete certainty and said, that's a brain tumor. And I remember thinking, I don't know, I think I would remember that. I don't think it's a brain tumor. I didn't say anything to her, but I went to the nurse's station, I grabbed the Merck manual, which you're going to come to find is your Bible. And back then everything was a book and it was on paper, there was no Google. And I looked it up, and a pheochromocytoma is a benign lesion on the adrenal gland above the kidney. So it's not anything near a brain tumor. So intellectual integrity, you have to seek out your own evidence. Question everything. Question me. I will never be offended, okay? Because that is a sign of intellectual curiosity and integrity and courage. You want to see the evidence. It's not Miss Mary's way. It is the way, right? And I can always back my stuff up. Intellectual perseverance. You must never give up on learning, even when it gets tough, right? You have to have a burning desire for knowledge, but knowledge based in fact and science, right? That's what this is. The medical field is based in science. So perseverance, it gets hard. Believe me, I know. I went to nursing school. I had a baby and 2 toddlers, going through a divorce, single mother, you know, the whole nine. It was not easy, but I was determined, and I was going to steamroller anybody or anything that got in my way. Okay. And even to this day, you will find one of the things about me, if I read something or hear something and I don't know what it is, it will drive me insane until I look it up and fully understand it. Fact. Okay. So that's perseverance, intellectual perseverance. I've got to know facts. I want to learn more, even when the going gets tough. Faith and reason is believing in your heart of hearts in the power of science and reason and logic. Okay, we're not basing these things on emotion. Science, reason, and logic. And then fair-mindedness. It's the ability to consider an opposing point of view and to try to understand a new idea before you say, nope, don't want to hear it. Nope, this is the way it is. This is what I think. That's called concrete thinking, and that's not healthy, okay? It is very, very healthy to be open to the possibility of new evidence. I've been doing it this way for 35 years. You've been doing it wrong. You have to keep an open mind, okay? And when presented with evidence that says, well, I know you've been doing it this way for 35 years, but evidence-based research has shown us that this is a better way to do it for the patients, right? So you have to have the ability to change your mind, okay? So remember all those attributes as you move through the next 3 terms, because you're going to have to rely on them a lot and learn to develop and cultivate them in yourselves, okay? It's very important. So now, where do you get good information? Can you get it from a nursing textbook? Could you go to www.diabetes.about.com, right? Could you go to nlm.nih.gov? Nursing journals, medical journals, Ladies' Home Journal. I didn't even know they still made that magazine. You have to understand that the use of technology is awesome, okay? I don't do anything on paper. I do everything digitally, okay? Digital is the way to go. We are in 2020. It is a digital world. But when you're Googling things, you have to make sure that you're getting the information that Google gives from a credible source. You wouldn't use Wikipedia. And so for that same reason, what kinds of resources would you use? So yeah, you would use a textbook, medical textbook, or a nursing textbook. You wouldn't use diabetes.about.com because who are they? That's not a credible resource. It's something that, someone made that website. Maybe their information isn't accurate. Peer-reviewed nursing journals and peer-reviewed medical journals, they are good sources, okay? And we'll talk about how to differentiate. You would never use Ladies' Home Journal, but you would use the merckmanual.com/professional, okay? And the nlm.nih.gov. When you see .gov or .edu at the end, you can be relatively certain that that is a governmental website or a higher learning institutional website. So you're going to get more credible information from those. All right, so make sure. Don't tell me that you went to WebMD, because WebMD is not meant for professionals. WebMD is meant for lay people who have questions and they forgot to ask their doctor, so they want to look it up on their own. That's not for us. We're nurses, we're professionals, okay? How do we solve problems? Well, before you solve it, you have to identify it. So you got to gather your information and identify what is the problem. And then what do I want to happen? How do I develop a plan? What am I going to do that would help me solve this problem? And then I'm going to implement it or do it. And then when I'm all done, did it work? That's the evaluation. Did it work? Okay? And that's the nursing process. It's that simple. That's care planning. So when people say, oh, I got care plans to do, care plans are so hard. Care plans are the easiest thing you will ever do. Okay? And we will talk more about them in class when I see you this coming week. Because a care plan is just you going, all right, I'm assessing the patient, coming up with some nursing diagnoses about either what is actually wrong or what might go wrong. I'm going to come up with some kind of a plan so that things don't go wrong. And then I'm going to implement that plan. And then I'm going to evaluate it and see, did it work? Okay, it's very easy. The word vigilance, when we're talking about nursing, is the act of being attentive, alert, and watchful. You must always be vigilant when you're caring for patients. In other words, you must always have your eye on the patient, just making sure that nothing's happening that's untoward or that shouldn't be happening. And there's the nursing process, ADPI, assess, diagnose, plan, implement, and evaluate. So in that process, what's your role? So your role is to collect data. You assess the patient. You collaborate with the RN to come up with nursing diagnoses and come up with outcomes and plan care. You help with implementing the interventions, and you assist with the evaluation. Did it work? When we talk about gathering data, you have subjective and objective data. Subjective data, what's the patient telling you? Okay, that's subjective data. Objective data are things that are measurable and that can be seen, right? So subjective data, what's the patient's chief complaint? I can't sleep at night. You have to take their word for it, right? And so utilizing an acronym, there's something in your book called What's Up. It's an acronym that uses the letters What's Up to help you remember the kinds of questions that you ask in relationship to the interview between yourself and the patient. You're always going to get a health history. You're going to ask patients very intimate details about their personal lives and their personal habits. You're going to make sure that, what is their family role? Are they a mother? Are they a father? Are they a single family or single provider family where mom is the sole provider for the family? Does she have a support system? Any other family members that can help? And then also you want to make sure that you're respectful and mindful of people's cultural or spiritual beliefs. You don't have to agree with them. You just have to respect them, okay? Everyone's entitled to their own. Here's that what's up acronym. So with the chief complaint, patient that says, I have pain. Where is it? How does it feel? What makes it worse? What makes it better? Those are aggravating and relieving factors. The timing of the pain, the severity, that's that scale, 0 to 10, right? U is for useful other data. Was there a mitigating factor? In other words, when you tell me your back hurts, did something happen right before your back started hurting, like you fell? That'd be important to know. And then what is the patient's perception? That's important. We need to know how the patient feels. We're treating a human being, right? So it's important to get all the information. Objective data, you're inspecting. You are inspecting a patient the minute you lay eyes on them. I'm assessing people in ShopRite, okay? When people are walking by me, I'm going, oh, congestive heart failure. Oh, COPD. You will be able to do that in your mind. You're looking at their skin, at their hair, at their posture, the way they're walking, the ambulation, all those things, inspection. You'll palpate. You don't necessarily percuss, but we'll talk a little bit about it. And you'll auscultate. You'll listen, right, with your stethoscope. These are all ways to gather that data. So now, little thing, what's subjective, what's objective? If you read in a nursing note, left leg lesion, 2 by 3 centimeters, is that subjective or objective? That would be objective because it's measurable, right? And the nurse did a pretty okay job of saying, where is the lesion? I don't know where on the left leg the lesion is. I would have been a little more specific, but it's still objective because that is something that you can see and it's measurable. How about patient stating, I feel nauseated? Subjective or objective? Subjective, because you have to take their word for it. How about patient complaints of chest pain? Subjective. How about heart rate, 72 beats per minute? Objective, right? That's something you can measure. How about patient worried about upcoming surgery? Subjective. You have to take their word for it. They're telling you that they're worried, so you have to believe them, right? Okay. When we document, documentation has to be accurate, concise, and objective. So, if you've ever read notes that read, received patient, awake, alert, and oriented, ×3, supine in bed, call bell within reach, vital signs stable, no acute distress, will continue to monitor. What did that note tell you about the patient? Nothing, right? So when you're writing a note, it's got to paint a picture. Tell me a story, Admitted 73-year-old Caucasian female with a primary diagnosis of right-sided congestive heart failure. And then vital signs, what is the apical heart rate, the blood pressure, what is the temperature, respiratory rate, what do the lungs sound like, pulse ox. So we'll go through note writing, okay? But it's got to be accurate, concise. In other words, concise means get to the point, right? And objective. No opinion in a nursing note. In other words, patient is behaving in a way that is difficult. Patient is being difficult. What does that mean? Right? Now, if I said in a note, patient slapped nurse when attempting to obtain a blood pressure, that's objective because I'm writing what happened. But for a nurse to write patient is difficult, I don't know what that means, right? So that's not objective. You wouldn't write something like that. And then when we talk about diagnoses, there are nursing diagnoses, there are medical diagnoses. Don't worry so much about collaborative, but you're going to be interested and concerned with and dealing with nursing diagnoses and medical diagnoses, right? They're the things that we will talk about. With nursing diagnosis, there's a problem, and then there's a cause of the problem or what the problem's related to. And how did you know that there was that problem? What are the signs and symptoms? Okay. So the etiology, when you see the word etiology, that's the cause, right? Cause of something, what made something happen, okay? And when we plan care, we're always going to talk about prioritizing, right? because you may have a patient with 7 or 8 nursing diagnoses, but which ones are the most important ones that are more critical to their well-being? Okay, and how do we come about prioritizing? Well, here's Maslow's hierarchy. Maslow's hierarchy would be the second thing that you would use to prioritize. The first thing you would use are ABCs: airway, breathing, circulation. If the patient can't breathe, guess what? None of Maslow's hierarchy even matters, right? Because they'll die from not being able to breathe, which is the bottom of the pyramid, physiological need. So in other words, your fundamental needs, you need food and water and shelter and sleep and air, okay? And all those things. So that's the bottom of the pyramid. But then once those needs have been met, then we need safety and security, right? And then love and belonging, and then self-esteem, and then self-actualization. That's the highest part of the pyramid. So in other words, I can't even think about helping a patient with self-actualization until I'm certain that all those other needs have been met. So basically, to make it a little more simple, when you're prioritizing nursing care, ABCs, and then you're going to say to yourself, acute versus chronic, and then Maslow's hierarchy, okay? So if you have a patient that's on a ventilator, that, you know, that's kind of a high-risk patient, unstable patient, and then you have a patient that is a COPD patient that has a pulse ox of 87%, but they're on 2 liters of oxygen. Which of those patients would be more critical? Who would you see first, the guy on the ventilator or the COPD guy with the 87% pulse ox? You want to say to yourself, they're both airway and breathing, right? So now we talk about acute versus chronic. Which of those 2 patients is more acute than chronic? And which of those 2 is chronic more than acute? Is it the man on the ventilator, or is it that COPD patient with that 87% pulse ox on 2 liters of oxygen? Okay. We're going to talk more about this, but I'm curious to hear what you think, what your thoughts are. Okay. Also, when we talk about nursing care plans, when you get to the outcomes, they have to be measurable. Measurable. I can't say this enough. The outcomes have to be measurable and in a specific time frame. So in other words, if I were talking about somebody who, I'm even going to put an example here. So an example would be, you know, if the patient has a fluid volume deficit, okay? So what would an outcome be? Okay? An outcome would be patient takes in 3,000 milliliters of fluid in 24 hours. Okay? That is a measurable outcome with a specific time frame that's realistic. Patient will take in 3,000 milliliters of fluid in 24 hours. And when we're talking about hospitals, acute care, they're going to be shorter time frames, right? If we're talking about long-term care, I'm going to be talking about maybe a time frame for a week or so, depends. But just so you understand, it's got to be specific and measurable when we talk about outcomes, okay? And then the interventions have to be goal-directed. In other words, what are you doing? And I'm going to refer you to looking at your textbook and pulling up a care plan for pain under the chapter that's covers pain. And we're going to talk about that nursing care plan and how you can manipulate that care plan to fit a patient if your patient indeed has pain, okay? Implementation involves communication and documentation. And then evaluation, did it work? Everything that you did it work? It either did or it didn't. If it did, yay, resolved. If it didn't, then you have to revise the care plan. You're not going to just, you know, toss it. You're going to change it, revise it. So maybe you're going to change, all right, well, the nursing diagnosis, yeah, that's going to stick. But maybe that intervention wasn't the right one for that patient. Or maybe my goal was a little too far reaching, when maybe I need to manipulate the goal a little bit. And we'll talk more about care plans. Okay, and then there are some review questions at the end of this chapter, just like every other one. So this is your first video that you got to watch of a lecture for chapter 1 in your textbook. And this is the way that they're going to be. So I've taken the PowerPoints from every chapter that we cover in both nursing and pharm, and I kind of modify them, take some stuff out, put some stuff in, and lecture on them. So congratulations, you just got through lecture number 1. All right, guys, see you soon. Take care. Bye-bye.